This podcast does not provide medical nor legal advice. Please listen to the complete disclosure at the end of the recording.
Hello, possums, and welcome to Everyone Dies, the podcast where we talk about serious illness, dying, death, and bereavement. I'm Marianne Matzo, a nurse practitioner, and I use my experience from working as a nurse for 45 years to help answer your questions about what happens at the end of life.
And I'm Charlie Navarrete, an actor in New York City, and here to offer an every-person viewpoint to our podcast. We are both here because we believe that the more you know, the better prepared you will be to make difficult end-of-life decisions.
So please relax, get yourself something to eat and drink, and thank you for spending the next hour with Charlie and me for our discussion about HPV in your child's future. In the first half, Charlie answers the question, what really killed William Henry Harrison? Because I know we all want to know.
Yeah.
In the second half, I'm going to talk about the HPV virus, what it is, how it relates to cancer risk, and your children. And in the third half, Charlie answers a question about helping a parent who is a hoarder. Our recipe this week is a chewy, nutty squirrel bar. And no, it's not made out of actual squirrels.
Oh.
This way, if you decide that you don't want to chat with someone at your next funeral lunch, you can offer them one of these bars and you'll both be chewing too much to talk. You're welcome.
Thank you.
Charlie, how are you?
Cooler. Temperature is dropping to a regular, nice, I was going to say fall-like, but no, it's still warmer than fall. But yeah, can't complain. What about you? What's going on?
What's going on? Nothing, actually. You would think something would be, but no, nothing.
Sometimes nothing is good. Just nothing going on.
I'm not complaining.
No, absolutely not. Yeah. Usually
when there's something going on, it requires a lot of work, emotional and physical. So, it's nice to chill.
Yes. Very good.
So what's all this fuss about William Henry Harrison?
Well, Harry and the Hendersons. Wait a minute. That was a movie. Here, let's try this one. William Henry Harrison, the 9th president of the United States, holds the distinction of being the shortest-serving president, dying on April 4th, 1841, just a month into office. Historians have accepted the diagnosis of Harrison's doctor, Thomas Miller, pneumonia of the lower lobe of the right lung complicated by congestion of the liver. The pneumonia was thought to be a direct result of a cold the 68-year-old Harrison caught while delivering a numbingly long, actually the longest in history, inaugural address in wet, freezing weather without a hat, overcoat, or gloves. I'm wondering why Bernie Sanders didn't just let him wear his coat and gloves he is now famous for since the last inauguration. But I digress. When Dr. Miller went to the White House on March 26th, President Harrison reported anxiety and fatigue, not lung issues. Dr. Makowiak, who wrote Diagnosing Giants, Solving the Medical Mysteries of 13 Patients Who Changed the World, looked at President Harrison's medical record through the lens of modern epidemiology, the study of the patterns of a disease in a population, which makes it far more likely that the real killer lurked elsewhere. In a smelly marsh.
Dun, dun.
Yes, exactly. In a smelly marsh not far from the White House. Oh, the things that come to mind of a smelly marsh. Close to the White House.
Drain that marsh.
Yeah, there we are. In those days, the nation's capital. This is serious stuff. Let's get through this. In those days, the nation's capital had no sewer system. God, this is just a gift. Until 1850, some sewage simply flowed onto public ground a short distance from the White House, where it stagnated and formed a marsh. The White House water supply was just 7 blocks downstream of a depository for night soil, hauled there every day at government expense. I love metaphors too, just to let everyone know. The field of human excrement. God, this is a gift that just keeps giving. The field of human excrement would have been a breeding ground for 2 deadly bacteria.
Control yourself, Charles.
Well, I was going to say Democrats or Republicans, but, well, okay, fine.
Yeah, control yourself.
All right. 2 deadly bacteria, Salmonella typhi and S. paratyphi, the cause of the typhoid and paratyphoid fever, also known as enteric fever, for their devastating effect on the gastrointestinal system. Harrison had a history of dyspepsia, or indigestion, which potentially heightened his risk of infection by gastrointestinal pathogens that might have found their way into the White House water supply. Dr. Miller repeatedly gave Harrison enemas which are potentially dangerous. They can perforate ulcers produced by S. typhi and S. paratyphi in the ileum, the lower end of the small intestine, through which the bacteria would be able to escape from the intestine into the bloodstream, resulting in sepsis. As he lay dying, Harrison had a slow pulse and cold, blue extremities, 2 classic manifestations of septic shock. Given the character and course of his illness, President Harrison's death is best explained by enteric fever, with pneumonia as a secondary diagnosis. Well, that's a mouthful. So, I mean, nowadays it would have been pretty much nothing, right? I mean, a doctor would be able to take care of that pretty easily.
Well, and it probably wouldn't have happened in the first place because we have sewage systems now. And, in fact, in the early part of the 1900s, when sewage systems were being built and water treatment was, going on, there was a huge decline in the death rate because people, those were the things that were killing people in the past. And once you took care of it with a good sewage system, you took care of those kinds of diseases.
So, do you know, before the Europeans arrived in the States, how did the Native Americans do it? I mean, did they know, for example, to boil water, or they just knew over time if the water looked a certain way, a stream or something like that, to avoid things like that? Or am I naive and Native Americans were also subject to this?
Well, it seems to me, if I remember my history right, one of the things that the white people brought was dysentery to the Native Americans.
The gift that just keeps on giving. Yeah.
Yeah.
Oh, well. So, please go to our webpage for this week's recipe of squirrel nuts. Chewy squirrel nuts. Yeah, it still can't be right. Chewy, nutty squirrel bars. These guys have a place to drink. And additional resources for this program. As you can tell by Marianne's knowledge of this stuff, it's not stuff, but this is important. Your tax-deductible donations will go far and are always welcome so that we can continue to offer you quality programming. Thank you in advance for making your donation at www.everyonedies.org. That's every, the number 1, dies.org. Marianne?
Thanks, Charlie. We talked a few weeks ago about Merkel cell cancer and the associated virus that's thought to be a major risk factor for the skin cancer. And as we learn more about the origin of diseases, it's increasingly common to find a virus to be identified as increasing the risk of a disease. And that is true for our discussion about human papillomavirus, HPV. And that's what I'm just going to call it for the rest of this chat. Now, there are approximately 150 types of HPV that have been identified, and at least 40 of these infect the genital area. The majority of HPV, and now make sure that we're talking about HPV in your head. We're not talking about HIV, which is a whole other thing. So the majority of HPV infections run their course and heal themselves. They have no symptoms so that you can not even know that you have it. They are self-limited, meaning they heal themselves, are asymptomatic, meaning you don't have any symptoms of them, and can go unrecognized. Sexually active people are usually exposed to HPV sometime during their lifetime. About 13 million people, including teens, become infected with HPV each year. But there are also high-risk HPV infections, like, for example, HPV type 16 and 18, that cause most cervical, penile, vulvar, vaginal, anal, and oropharyngeal cancers and precancers. Whereas other HPV infections, like HPV type 6 and 11, cause genital warts and recurrent respiratory papillomatosis. Persistent cancer-causing HPV infections is the strongest risk factor for development of the HPV attributable precancers and cancers. A substantial proportion of cancers and genital warts are attributable to HPV. In the United States, high-risk HPVs cause 3% of all cancers in women and 2% of all cancers in men. Each year, there are about 45,000 new cases of cancer in parts of the body where HPV is often found. And HPV is estimated to cause about 36,000 of these, according to the Center for Disease Control. Worldwide, the burden of HPV-related cancers is much greater. High-risk HPV causes about 5% of all cancers worldwide, with an estimated 570,000 women and 60,000 men getting an HPV-related cancer each year. Cervical cancer is among the most common cancers and a leading cause of cancer-related deaths in low and middle-income countries, where screening tests and treatment of early cervical cell changes are not readily available. HPV vaccinations prevent new HPV infections, but they don't treat existing infections or diseases. That is why the HPV vaccine works best when given before any exposure to HPV, meaning before ever having sex. And this is the focus of our chat today. I'm going to talk about how HPV causes sexually transmitted infections and the types of cancers that can result. Now, I appreciate that you may not want to hear these details, but let me give you the bottom line right now. Boys and girls ages 9 to 25 should all be receiving the 2-dose HPV vaccine to prevent cancer. This is the only cancer vaccine currently available. I mean, that's incredible, right? We have a cancer vaccine that we can give to people to prevent cancer. Now, personally, I would not want to be the mom to a child who developed an HPV-related cancer and must answer the question, Mom, why didn't you get me vaccinated to prevent all this? I'm hoping that when you hear this information, you won't have to answer that question for your own child or any child that you love. I've cared for far too many adults with these cancers who have gone through disfiguring surgeries, chemotherapy, radiation, and have been with them during their dying process. And I'm really hoping that future generations will be spared these cancers. I had one young woman in her early 30s who had an HPV cervical cancer, and I'm going to talk more about cervical cancers in a few minutes. But she was really, really sick, had gone through terrible surgeries, and was in the last phases of her life. And I remember her coming into the clinic to see me and how thin and very sick that she was. And, we're talking about pain management and that kind of thing, referred her to hospice. And when she left her appointment, she said, "Can I give you a hug goodbye?" And I gave her a hug, and I knew I wasn't going to see her again. I was in the clinic, I knew she wouldn't be coming back. And when she left, there was a little bit of her pink lipstick on my lab coat. And for a few months, I didn't send my lab coat out to be clean because I liked seeing that little bit of pink lipstick that reminded me of her. And it's not the parents only that lose these people to death. Your clinicians do feel the loss of their patients too. So you might be wondering, why am I talking about this topic now? Well, for the first time in a decade, the rate at which American adolescents receive the HPV vaccine has not increased. Vaccination rates had risen steadily since 2013, but then plateaued last year, according to the U.S. Centers for Disease Control and Prevention. Whatever reason is that this has occurred, as parents and grandparents, we can change this trajectory and have a chance at stopping the cancers related to HPV. And, there's a lot of politics around vaccinations, which I don't personally think that politics should have anything to do with vaccinations and all of that. And I'm not here to debate that. I'm just here to tell you facts as we know them. And hopefully, as you listen to this, you'll make a decision to prevent cancer in our youngsters coming up. Now, I can remember when my girls were around 9 or 10 going to the pediatrician, and the pediatrician saying, well, it would be a good time to start their HPV vaccinations. And he said, we got to get them before they ever have sex, and we do it at a very young age. And I said, well, if it has to be before they have sex, we've got another 20 years or so to wait. He said, yeah, you're funny. He said, is it okay? And I said, absolutely. If I can prevent my child in their future years from getting any of those cancers, yes, I'm going to do it. And the girls got both of their HPV vaccines at about the age of 10. Now, HPV vaccination works extremely well, and the vaccine has the potential to prevent more than 90% of HPV attributable cancers. Since HPV vaccination was first recommended in 2006, infections with HPV that cause most HPV cancers and genital warts has dropped 88% among teen girls and 81% among young adult women. The protection provided by HPV vaccine lasts a long time. People who receive HPV vaccines were followed for at least 12 years, and their protection against HPV had remained high with no evidence of decreasing over time. So why is this vaccine important? Almost every unvaccinated person who is sexually active will get HPV at some time in their life. Everyone. About 13 million Americans, including teens, become infected with HPV each year. Now, most HPV infections will go away on their own. They're like any other kind of virus. They're self-limiting, they will go away. But infections that don't go away can cause the following types of cancer. They can cause cervix, vagina, and vulva cancer in women, cancer of the penis in men, anus cancer in both women and men, and back of the throat called oropharyngeal cancer, including the base of the tongue and tonsils in both men and women. Now, while I'm not going to go into a great deal about each of these types of cancer this week, let's just talk about them as they relate to HPV. And let's start with the men. Now, most men who get HPV never have symptoms. The infection usually goes away by itself. But if If HPV does not go away, it can cause genital warts or certain kinds of cancer. Certain men are more likely to develop cancers from HPV, such as men with weak immune systems, including those who are living with HIV, and men who receive anal sex are more likely to have anal HPV and develop anal cancer. HPV infection increases the risk of developing penile cancer with over 60% caused by HPV. Anything that increases a person's chance of getting a disease is called a risk factor. Not every person with one or more of these risk factors will develop penile cancer, and it will develop in people who don't have any known risk factors. So talk with your healthcare practitioner if you think you might be at risk. But the risk for penile cancer includes, number one, being uncircumcised. Now, circumcision may help prevent infection with HPV. Now, a circumcision is an operation in which a doctor removes part or all of the foreskin from the penis. Most boys are circumcised shortly after birth. Men who are not circumcised at birth may have a higher risk of developing penile cancer. Number two, being 60 or older. 3, having phimosis, which is a condition in which the foreskin of the penis cannot be pulled back over the glands. Having poor personal hygiene, having many sexual partners, and using tobacco products. Signs of penile cancer include sores, discharge, and bleeding. These and other signs may be caused by penile cancer or by other conditions, so check with the doctor if you have any of these symptoms. Redness and irritation or sore on the penis or a lump on the penis. Talk to your healthcare provider about anything new or unusual on your penis, scrotum, anus, mouth, or throat, which includes warts, unusual growths, lumps, or sores. Now for women. Cervical cancer. Virtually all cervical cancers are caused by HPV. Routine screening can prevent most cervical cancers by allowing healthcare providers to find and remove precancerous cells before they develop into cancer. As a result, cervical cancer incidence rates in the United States are decreasing. Estimated new cases of cervical cancer for 2023 is 13,960, with a 5-year survival rate of 67.2%, which means that 32.8% of the women diagnosed with cervical cancer will die within 5 years of diagnosis. So just in case your anatomy is a little unclear, the cervix is a cylinder-shaped neck of tissue that connects the vagina and the uterus. It's located in the lowermost portion of the uterus, and the cervix is composed primarily of a very fibrous muscular tissue. HPV is the most common viral infection of the reproductive tract. More than 90% of infected women eventually clear the infection. Cervical cancer is by far the most common HPV-related disease. Nearly all cases of cervical cancer can be attributed to HPV infection. Although most HPV infections clear up on their own and most precancerous lesions resolve spontaneously, there is a risk for all women that HPV infection can become chronic and precancerous lesions progress to invasive cervical cancer. Now, it takes 15 to 20 years for cervical cancer to develop in women with normal immune systems. It can take only 5 to 10 years in women with weakened immune systems, such as those with untreated HIV infection. Symptoms of early-stage cervical cancer may include irregular blood spotting or light bleeding between periods in women of reproductive age, postmenopausal spotting and bleeding, bleeding after sexual intercourse, increased vaginal discharge, which can sometimes be bad smelling. As cervical cancer advances, more severe symptoms may appear, and these include persistent back, leg, or pelvic pain, weight loss, fatigue, loss of appetite, bad-smelling discharge and vaginal discomfort, and swelling of a leg or both lower extremities. Besides the HPV vaccination, regular cervical cancer screening with a pap smear and HPV tests and follow-up are important. The pap test can detect all cell changes in the cervix before they turn into cancer. The HPV test looks for the virus that can cause these cell changes. Screening can detect most, but not all, cervical cancers at an early, treatable stage. Most women diagnosed with cervical cancer in the United States have either never been screened or have not been screened in the last 5 years. Next is vulvar cancer. 70% of vulvar cancers are caused by HPV. Vulvar cancer is a cancer of the vulva, the outer portion of the female genitals. It is most common, affects the labia majora. Less often, the labia minora, clitoris, and vaginal glands are affected. Symptoms include a lump, itchiness, changes in the skin, or bleeding from the vulva. Estimated new cases of vulvar cancer for 2023 is 6,500 women, with a 5-year survival of 69.6%, meaning 30% will die within 5 years of diagnosis. Vaginal cancer. 75% of vaginal cancers are caused by HPV. And let me just throw in here, remember, we have a vaccine for HPV, so that 75% of vaginal cancers could be avoided if the kids were vaccinated at the time they're supposed to be. So, risk factors of vaginal cancer are being 60 years or older, having HPV infection, which can be linked to squamous cell carcinoma of the vagina, being exposed to DES while in their mother's womb. In the 1950s, the drug DES was given to some pregnant women to prevent miscarriage, which is premature death of a fetus that could not survive. This is linked to a rare form of vaginal cancer called clear cell adenocarcinoma. The rates of this disease were highest in the mid-70s and is really pretty rare now, having had a history for tumors that were benign, meaning that they weren't cancer, or having been diagnosed with cancer and having a hysterectomy. Now, those HPV cancers that relate to both men and women. Oropharyngeal cancer. Now, most of these cancers which develop in the throat, usually the tonsils or the back of the tongue, are caused by HPV. And that 70% of these cancers in the United States are caused by HPV. And you might remember about 10 years ago, Michael Douglas being diagnosed with this and going on the talk shows and talking about how cunnilingus was the cause of his cancer. And people kind of went a little nuts with that. What's he talking about? They'd never heard of this. And so they had to do a little education back then. And I don't know, I think probably that faded away. But he was right that, certain sexual acts will, take that HPV virus and put it in the mouth, and you can get these kinds of cancers. The number of new cases is increasing each year, and oropharyngeal cancers are now the most common HPV-related cancer in the United States. It's estimated that new cases of oropharyngeal cancers in 2023 will be 54,540 people. 54,000 people, Charlie, with a 5-year survival of 68.5%, meaning that 31.5% will die within 5 years of that diagnosis. Symptoms of oropharyngeal cancer may include a long-lasting sore throat, earaches, hoarseness, swollen lymph nodes, pain when swallowing, and unexplained weight loss. Now, some people have no symptoms, but if you have any symptoms that worry you, be sure to see your doctor right away. Alcohol and tobacco products may contribute to oropharyngeal cancers. Don't smoke or use smokeless tobacco products and avoid smoke from other people's cigarettes. Limit the amount of alcohol you drink. When used consistently and correctly, condoms and dental dams can lower the chance of HPV is passed from one person to another. But I think the thing there is used consistently and correctly, because people don't use them correctly and they definitely don't use them consistently. The other thing for prevention is to be in a mutually monogamous relationship or have sex only with someone who only has sex with you. Now, anal cancer. Over 90% of anal cancers are caused by HPV. 90%. The number of new cases and deaths from anal cancer is increasing each year. Anal cancer is nearly twice as common in women as in men. Estimated new cases of anal cancer for 2023 is estimated to be 9,760 people, with a 5-year survival of 70.4%, meaning that 29.6% will die within 5 years of the diagnosis. Now, you can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It most commonly spreads during anal or vaginal sex. It also spreads through close skin-to-skin touching during sex. HPV can spread even when a person with an infection has no signs or symptoms. If you are sexually active, you can get HPV even if you've had sex with only one person. Symptoms can appear years after you have sex with someone who has the infection. This makes it hard to know when you first got it. Another kind of troubling trend is that young people are having more anal intercourse. An estimated 3 to 24% of all reported sex acts among young people were anal intercourse. Reported heterosexual anal intercourse is common but variable among young people worldwide, as reported in a systematic review by Owen and others. A 2022 study surveyed more than 3,000 women ages 18 to 93, and 40% said that they found pleasure in anal play, and the results revealed that it's more about touch than about penetration. And it's like this common thing also among young people in saying, well, I want to be a virgin, so I'm not going to have vaginal intercourse. I'll just have anal intercourse. So, the cost of HPV. A major barrier in the United States is the ability to pay for HPV vaccines if a person's uninsured. Now, Gardasil, which is the drug that we use most in the United States because it covers all the different types of the viruses that cause the cancers, costs $268 per dose, and 2 doses are required. In 2022, just over 39% of uninsured kids who turned 13 in 2022 had gotten vaccinated. Only 39% of these uninsured kids. Vaccinations are also vary widely by state. For example, while almost 95% of kids in Rhode Island had received at least 1 dose of the HPV vaccine by somewhere between 13 to 17 years of age, that number fell to 61% for children living in Mississippi. But there are programs in the United States. The Vaccines for Children's program is a federally funded program that provides vaccines at no cost to children who might not otherwise be vaccinated because of inability to pay. And I put all the links for how to contact them in our show notes. So, most people, I would say, all people don't want to get cancer. So how can we prevent these types of cancers? So first, you could abstain from sexual activity. That's the most reliable method for preventing genital HPV infections. Persons can decrease their chance of infection by practicing consistent and correct condom use and limiting their number of sex partners. Although these interventions might not fully protect against HPV, they can decrease the chance of getting and transmitting HPV. Second, HPV vaccines are safe and effective and are recommended routinely for adolescents ages 11 to 12 years old, but they can be given to children as young as 9. Now, when these vaccines first came out, they were only given to girls. Now they give them to boys and girls because, well, they both need that. They both need the vaccine because if they have sex with each other, if the boys aren't vaccinated, they can give the virus to the girls, and all girls are not vaccinated. And there are, as we've learned more, that there are cancers that men get that are related to HPV, and so they need that protection also. Now, condoms that are used consistently and correctly can lower the chances of acquiring and transmitting HPV and developing HPV-related diseases like genital warts or cervical cancer. However, because HPV can infect areas not covered by a condom, condoms might not fully protect against HPV. You could limit the number of sex partners so you reduce the risk of HPV. However, even persons with only one lifetime sex partner can get HPV because if their sex partner ever had sex with anybody else, they could have the HPV and bring it home. So, what does HPV mean for relationships? HPV infections are usually temporary. A person may have HPV for many years before it causes health problems. If you or your partner receive a diagnosis of a disease from HPV, there is no way to know how long you've had HPV, whether your partner gave you HPV, or whether you gave HPV to your partner. HPV is not always a sign that one of you is having sex outside of your relationship. It's important that sex partners discuss their sexual health and risks for sexually transmitted infections with each other. The bottom line about HPV is that if our children are going to be sexually active when they grow up, and let's just assume they will be, they need the HPV vaccine to prevent HPV-related cancers. I have taken care of so many people with these types of cancers who were young before we had these vaccines. Other than abstinence, they had no way to lower their risk. Also, for many of the older men that I've taken care of with HPV-related throat cancers, they, like Michael Douglas and the rest of society, didn't even know that HPV could be the cause of such a thing. Other than abstinence, they had no way to lower their risk. We no longer can say that. We can prevent these cancers from being a part of their future. You know, I honestly don't know what I could say to my girls if they got one of these cancers and I had not had them vaccinated. You know, their suffering would be great. And I tell you, as knowing myself, that my guilt would be overwhelming. So think about the children in your life that you love, if it's a parent or as a grandparent, and ask the question, have they been vaccinated against HPV? And if the mom or whoever it is that's making these decisions says, no, they haven't, then, I don't know, refer them to this recording and say, listen, just listen to this, and then let's talk about this. Because what we're talking about is cancer in their, you don't know, could be in their 20s, could be in their 30s. I've had patients in their 80s have HPV-related cancers. You don't know when it's going to rear its head, but we can test to see, is this cancer of that HPV variant? So we know, yeah, that's what this is. Charlie?
Wow. Holy shit. It's not October, but this is so scary. All right, well, let's get to this. You know, I'm not young. I'm in my 60s.
God knows that's the truth.
Yeah, God's not the only one. Most people know that. So, Marianne, for someone middle-aged, cunnilingus, what is this well, I guess it has to be a conversation. I mean, how, as a professional, how would you bring this up to someone? Or how would I bring this up to someone? How would I bring this up to a woman?
Well, I think that if you're planning that, then you go to the drugstore ahead of time and you get some dental dams, which is sort of like a big
dental what, please?
Dams, DAMS.
Okay.
And they should be like in the contraceptive department, or maybe they're in the female, or just ask the pharmacist. But they're like this sheet of, I don't want to say it's like a sheet of saran wrap, but it's sort of like a sheet of saran wrap that you would put over the clitoris and the vulva, and then you can do your thing without there being any sharing of fluids.
Okay.
So let's give a minute for Charlie to like write that down.
I have heard of HPV. I didn't know that much. I knew, to me, in my mind, it was just simply associated with younger people, in their teens or 20s. Gosh, I guess it's kind of like the gift that keeps on giving.
Well, getting that vaccine before they become sexually active then protects them from ever picking it up.
Right.
You can talk with your healthcare practitioner if you're older than 25 about getting the vaccine, and they can discuss it with you and determine if they want to give it. But usually the cutoff is age 25, and then that'll cover you and help prevent like all of these very difficult cancers, because the treatment for most cancers is to cut out the cancer, is usually the first step, and then treating with chemo or radiation. Well, with a lot of these cancers, it's treated with radiation, which is, people think, oh, great, I only need radiation, I don't need chemo. But let me tell you, radiation is tough stuff. And it causes lots of other issues related to sexual health and sexual expression. For the mouth cancers, swallowing, I have a lot of guys when I was working at the VA in oncology who would get these types of cancers, and they'd say, well, maybe we should, how about if we put a PEG tube in, because they're going to be radiating that area, you're going to have a hard time swallowing. Oh, no, I'll be fine. And then 2 weeks later they're like, can I get that PEG tube, because they can't swallow because it's painful from the radiation. And and these are older adult people who, it's decided to rear its head at that point in their life. And for them, it couldn't have been prevented. And the thing is, and the thing that troubles me so much, is that this can be prevented. That, if I was working another 20 years, that I could see the slowing of these types of cancers, and some of them maybe not see at all. And it's very troubling to me that, the vaccine deniers and those types of views are interfering with this vaccination for kids, because I'm not sure that people really know the long-term consequences of not having their kid vaccinated, which is why I wanted to talk about that today. Had Michael ever been vaccinated?
I'm going to say no. Yeah, I'd have to check, but I don't think so, Mary Ann, and I'm embarrassed now because I was usually pretty much on top of these things. I guess not enough.
Well, they when he was 9, they were giving it primarily or only to girls. And I don't remember what year they kind of said all kids, but it's not that I don't think that you missed anything. I think that he was kind of in that cross place where it maybe didn't get brought up as he got into his later teens.
So, I mean, in general, American society in general, I mean, pediatricians, nurses, are they, bringing this up? Hey, your measles shots or this shots, the regular shots, kids get. Is this now part of the conversation from doctors to a kid or to a kid's parents?
I know it was my pediatrician brought it up. I guess the question is your kid going to a yearly physical with their pediatrician? Not all kids do that.
Right.
So if they only go for episodic, sore throats or this or that, and maybe don't go for a physical, it might not, show up on the list of things the doctor needs to talk with the kid about. Mothers might say, well, if it's not, or fathers, whoever's making the decision, well, if it's not a mandatory vaccine, I'm not going to get, I don't want them to get it. I've heard the argument that, well, if we vaccinate them against HPV, they're just going to think, at 9 years old, they can go out and have sex. It's like that is the strangest argument I've ever heard, because whatever age a child decides wants to have sex, they're going to go do it. Don't delude yourself. And they don't understand about long-term consequences enough to wear a seatbelt when they go out. So how are they going to say, oh, I have my HPV vaccine, I can go do whatever, which is just ludicrous. It just makes no sense whatsoever. So, you heard it here. Does not make any sense. It's not a permission to go be promiscuous.
Exactly, yes.
In any sense of the word. And I've talked with friends of mine who have kids in this age group, and I've said, oh, so, I don't know if it's polite to say, did, Susie get their HPV vaccine? But, I'm not polite, I guess, because I'll say, oh, did Susie get her HPV vaccine? Of course. Because I don't want Susie to have cancer when she gets old. And some of these moms who are like friends of mine, they'll say, well, no, I don't know what the long-term consequences of getting that vaccine. I'll say, the long-term consequence of not getting the vaccine, we know what it is. It's cancer. Hello? So, I don't have many friends. No, I'm kidding. But
jeepers! All right, so
it is good. I think it's good to say to your friends, and you can say to your friends if you have any too, Charlie. Say, hey, is your kid vaccinated? If they're especially if they're in that 9 to 25 year age range. I have a friend who has two sons and a daughter. None of them are vaccinated because, I don't know that much about it. It's like, I can give you info. You can look it up on the internet, Well, no, It's like, oh my God. And I have to just bite my tongue and deep breathe because I feel, as you can tell, pretty passionate about this. And you know why? It's because I hugged that girl goodbye. It's because I've taken care of so many men with this disease, with the oropharyngeal cancers. It's like when you see it, you can't unsee it.
Gosh, it's always fun talking with you. It's
Said no one ever.
Yeah, no, you're absolutely right. And to your point about you bring it up. The thing I usually bring up in conversation is, so do you have your end of life documents? So do you have a healthcare proxy? I usually begin with, do you have a healthcare proxy? And most people look at me, more than half, like, a what? And then we get into that conversation. So no, I bring this I don't bring this up, but I do bring up about documents all the time. Gosh,
Well,
I
add
just
this
might.
to your repertoire for people with kids.
I will now. I need to be.
I mean,
yes,
if you can save
Yeah.
one kid from getting an HPV related cancer, isn't it worth it?
Absolutely, yes. What? Oh, okay, then for someone older, in again middle aged, I guess it's what? Not I guess it's well, gosh,
You have to do the other things. You have to use condoms correctly, dental dams correctly, lower your risk by not smoking, not using alcohol. Smoking is a risk factor. If you listen to all as I went through the different ones, smoking shows up on almost every one of those because it causes changes in cells, and you've got HPV in there, and it just helps the two of them to work together to wreak havoc.
And I'm sorry, did you say? Well, I mean,
Alcohol. Yes, Charlie. I said you can lower your risk of oropharyngeal cancer by
but yes,
lower
by drinking,
by limiting your use of alcohol, because that just kind of wears away the
of course,
the throat lining and can open you up to that risk.
What I was thinking of, is this something I get regular checkups now. I don't. So on a regular checkup, is that something that's also tested through blood work? Because I get
it's not through blood work. For women, they'll check it when they do a pap smear. They'll take the cells. They could check the cells of from the discharge from the penis or from the back of the throat, because it's a virus, so it's not going to be in the blood. It's in the the cells, the skin cells.
All right. Okay, yeah, because actually the doctor does that.
But at this point in your life, you should assume that you've had it. But like I said, a lot of it will. It's self-limiting. It'll heal itself. It could be there, and then the next time you go back, it could be gone. And
but can it come back?
I said, there's if you have another sex partner,
right?
And you don't use a condom, So and there's also skin contact, and other ways that fluids can get. Through the skin. So, it's a hard thing to prevent, except it's not, because it's like the only cancer vaccine we have. You would think that people would be, lining up to have their kids have this because it's the only cancer vaccine we've got.
Damn. So could could someone, during the yearly exam, say to the doctor, "Oh yeah, can you also check me for HPV?"
You could, but what's the point?
Well, if I have it and give cunnilingus, some woman, I don't want to give it to her.
Well, but she could also have it and be giving it to you. I mean, you, like I said, buy dental dams and use those. But, because, like I said, because this year your physical, they check you and they see that it's there, doesn't mean that it's not going to heal itself.
Okay, so it's another conversation to have. All right.
So we can see here what Charlie's big dilemma is.
Well, I have never had a conversation about this with any woman. Wow. All right.
And I'm your first. Oh, it's so special to me.
Oh, jeepers. Okay, good. Welcome to the 21st century.
So speaking of ethical decisions, you got one for us?
Yeah.
Charlie's making a list about like where he's going to find dental dams. I think Amazon probably has them.
I can't just go to my local pharmacy. I mean, they have them too, don't they?
They should.
Yeah. No, I mean, Amazon is nice. Amazon is nice, but for me, I prefer to patronize like stores, and when I buy a book, I will go to a bookstore rather than order it. I do that pretty much with everything.
Okay.
Amazon doesn't need my shekels.
Okay.
So, moving on, in our third half, the Ethicist newsletter in the New York Times offers advice on life's trickiest situations and moral dilemmas from the philosopher Kwame Anthony Appiah. We thought we would share one that was published earlier this year. My mother and I have a strained relationship because of her myriad mental health challenges. Our communication is not great. She lacks self-awareness and can't tolerate any suggestions that force her to face her flaws. I first noticed her hoarding after her mother died, which probably began as a result of her inheriting my grandmother's remaining belongings. Now, in my mother's current large home, every room and closet, every tabletop and surface, every single area is bursting with piles of items. I live across the country, so her hoarding bothers me only when I visit. But now I'm visiting more frequently, often for weeks at a time, to help care for my stepdad after his recent cancer diagnosis. The hoarding and disorganization are becoming alarming to me because I fear it will impede his care and cause major stress if they need to sell the home for any reason. Plus, it's stressful when you can't find anything or put anything anywhere because of how much stuff there is. I thought about sending her books about decluttering or mentioning that we should tackle rooms together when I'm there. But part of me feels as if it's not my responsibility, and part of me is aware that she most likely won't be receptive to the idea that this is an issue she needs to address. Please help.
So how would you answer that, Charles?
First, I blame Marie Kondo. For those of you not familiar with Ms. Kondo's work, she is from Japan and created basically, the term she used is spark joy. If you see something, if you have something, and it just sparks joy in you, keep it. If it does not spark joy in you, get rid of it. Along the way, when I've spoken to different people, many say, oh, but I really love all these thousands of photos I have. And I've been able to introduce the idea to folks, take pictures of your pictures. Yes, some of them you'll want to keep. I do it, older pictures I keep. But for me, most of the pictures I'd had, I've just taken pictures of them. So now I have them, hopefully for all eternity, on my computer and my phone, and I can look at them whenever I want. And it's the same with different objects. So that just, things that spark joy, and everything else, photograph it. Or really, how many sets of teacups do you need? What do you think, Marianne?
But the issue that she's raising here is not that her mom is sort of rational about certain things, and she's saying that her mom doesn't tolerate suggestions that force her to face her flaws. So while your idea is a good idea, I don't think it helps.
Oh, someone who's kind of like an addict who's addictive to this.
Well, and we don't know. Sometimes it's a stress response. I can certainly see that if she inherited all of her mother's stuff and she never got away to putting it away, that it starts to pile up. Maybe she's additionally stressed about her husband being sick. But I think one thing for this woman is when she visits, maybe, clean the room that she's staying in so that she can find the things that she needs. And if, the stepdad needs, medicines or whatever, to, find a tote box or something and can, say, this is for dad. Let's put all of his dressings in here so that we know where they are when we need them. And I would think that her mom would be willing to probably do that for the stepdad. But, this daughter is saying, I don't think that mom's going to be open to it. But I would say, well, ask her and find out. Say, are you finding this stressful? When I come and visit, I'd be more than happy to help you with this. And, mom might say yes, mom might say no, but you don't know what the answer is going to be until you ask her. And then she might have to just reconcile herself that when mom does die, that she's going to have a whole lot to go through. But that's mom's house. And I really think that, you might have opinions, but it's not your house. So what mom wants to do, it's kind of as long as she has, capacity to make decisions for herself, she might say, this is how I want to live.
Yeah, makes sense. Well,
so what does the ethicist say?
Well, what he says, like many quandaries, yours involves both empirical and moral considerations. Hoarding disorder is a condition recognized in the Diagnostic and Statistical Manual of Mental Disorders, or DSM. And as in your mother's case, it is frequently associated with other psychiatric problems. It can have a genetic component and it worsens with age. The causes of this condition are not fully understood, and it is not easy to treat. The best studied interventions involve cognitive behavioral therapy, though some research suggests the approach doesn't work well for older adults, and improvement in these studies is often assessed by self-reporting. Even if you blitz clean a hoarder's abode, not to be done without consent, the hoarding will typically start again. If it's hard to treat hoarders who want to get better, the challenge is greater still with hoarders who don't recognize themselves as such. And because hoarders find it distressing to get rid of their stuff, simply offering to help clear things away isn't likely to go down well, nor is pointing out that the items in the hoard are not of any actual use. Part of the condition is a tendency to believe that something will come in handy in the future, or that disposing of it would be wasteful. Observing that your mother may have to sell the house and dispose of much of the hoard will probably just increase her distress. You should certainly look into contacting a mental health professional, and however much she resists it, you ought to broach the topic with your mother directly. Encourage her to recognize that she has a problem and that her hoarding may pose a risk to your stepfather's well-being and to her own. Tell her that there are forms of therapy that might manage it. Though she won't be grateful, you'll have done right by her. But the odds are slim that you'll be able to resolve the problem on your own. And you can't have real responsibility where you don't have real agency. And having agency means having the ability to act independent and to choose what action to take.
Yeah, I think about that.
Yep.
He's right.
Sound advice.
I concur.
Yes. Folks, thank you for listening. And please stay tuned for the continuing saga of Everyone Dies. And continue to pick up after yourself. Thank you for listening. This is Charlie Navarrete. And from a source I can't find, though life is now pleasant and sweet to the sense, we'll be damnable moldy 100 years hence.
And I'm Marianne Matzo, and we'll see you next week. Remember, help a child you love be vaccinated for HPV, and every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.